A team of Chinese doctors and experts have arrived in Nigeria to assist the country in tackling the coronavirus pandemic. The team, which arrived in Nigeria through the Nnamdi Azikiwe International Airport, Abuja, was received by a federal government delegation led by the Minister of Health, Osagie Ehanire. The Chinese team of doctors and experts came along with a new consignment of kit and medical equipment. Speaking to newsmen after their arrival, Ehanire thanks the Chinese government for sending experts and equipment to assist Nigeria in tackling the coronavirus pandemic. Experts will be quarantined for 14 days before they begin working fully in Nigeria.
They will be in quarantine for 14 days. They knew that before they came, and they have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. Nigeria NCDC has gone to see where they are supposed to be in quarantine, and will continue to pay. They are free to pay visits there throughout the 14 days. So that one is taken care of. But the equipment that has come today, we are very happy to see. The second consignment from China after Jack Ma consignment. So we believe it will help us a lot in addressing the gaps that we will have had in commodities and also very important equipment. When you ask how many ventilators you have, we have 50 ventilators more after this visit. And beyond the ventilators, we have this extracorporeal membrane oxygenator, which is similar to a heart-lung machine, a very sophisticated equipment of which I'm not sure we have one here, but it's similar to a heart-lung machine to treat those cases where even the ventilator has failed. So these are the extremely important addition to our regiment of treatment options. Well, first of all, what we'll be doing here is capacity building to add to the body of knowledge which our own doctors and experts have, especially if you are hearing from those who have had hands-on experience, who have had personal experience about it. So the visit of this team is going to be very helpful to us, and I'm sure the most curious of all persons will be our own scientists, who I'm sure have many, many questions. Therefore, even while these ladies and gentlemen are already in quarantine, I have requested that they be able to connect with our scientists and doctors via teleconferencing so that we can start right early to be able to ask questions and hear their narratives. In the first place, the medical team that came from Midora are experts in managing viral diseases generally, and this is a viral disease also. But you know that the coronavirus is a novel virus. It's said to be a new virus, so it has new dimensions which are new to us, which even the experts among us would like to know more about. So the visit of the experts from China, the technicians and the medical personnel who are able to give us information on not only on public health aspects, but also on case management and on all the difficulties they had.
Good evening. We greet you all once again, and we must forever appreciate the very, very active, inquisitive, and curious Nigerian journalists who will want to get into everything and expose everything. It's good for a democracy, and we thank you for it. Indeed, 15 Chinese nationals came into Nigeria on the 8th of April this year. And from everything we have heard and said, they were here on the bill of CCECC, a Chinese company working in Nigeria, doing some work for us in several places. And in conjunction with some Nigerian companies, agreed to support us in the effort to respond to the pandemic. At IDU, they participated in retrofitting and equipping the isolation center there. They equally worked on the dome project that was handled by the NNPC consortium in conjunction with this day. And the lead company in the NNPC consortium is Sahara Energy. So those are the locations in which they came to work. both in retrofitting the entire facilities, the two facilities, and installing critical, essential, and sensitive medical equipment. They came in, 15 of them came in on the 8th of April. They came on a 30-day visa issued in Beijing. They are still here. And I know I need to tell you why they are here. They are still here, not because they've not completed their job, but because there is a restriction on travels in Nigeria occasioned by the protocol of COVID-19. I think that answers the question. I thank you.
The House is aware that on the 3rd of April 2020, the federal government announced that an 18 team of medical personnel comprising of doctors, nurses, and other medical advisors will arrive the country along with a plane load of additional PPE on the 8th of April 2020. A 15-member team of Chinese medical personnel arrived in the country to share their experiences in fighting COVID-19 pandemic and were received at the Nnamdi International Airport, Abuja, by some government officials, including the Minister of Health. Aware also that the decision to bring in Chinese medical personnel into the country to help the fight against COVID-19 by federal government sparked a lot of controversies from some Nigerians who kicked against the decision, saying that the country has enough doctors and nurses who are able to tackle COVID-19 pandemic. Further aware that in response to the controversies, the Honorable Speaker, Right Honorable Femi Gbajamiela, convened a meeting between the leadership of the House and Minister of Health on 7th April 2020. The Right Honorable Speaker insisted that the medical team must undergo the necessary checks as provided by the NCDC and also go on 14 days isolation before any interface with Nigerians. Further aware that the team arrived in Nigeria on the 8th of April 2020 with a confirmed press statement by the Minister of Health. Concerned that contrary to the earlier statement of the Minister of Health on the 14th of May 2020, in a new twist, reportedly told news reporters not to bother his ministry over the whereabouts of the Chinese medical experts who came into Nigeria to support the fight against COVID-19. While responding to questions at the daily Presidential Task Force on COVID-19, the Minister of Health said the medical personnel are not guests of the federal government, but CCECC, a construction company. The minister went further to say that I want to explain that first of all, I think not all of them are doctors. And I heard that some of them are technicians, but they are staff of CCECC. The Ministry of Health is not their host, so we cannot always explain what happened to them or their whereabouts. The Minister of Health also noted that there seems to be a lot of interest in the doctors, but they are staff of a company. I'll be very happy if you do not ask me where they are. And further said, as they are unaware of their location of the 15 Chinese nationals who recently came into the country. Notes that following complaints of concerned Nigerian citizens, it is incumbent on us to duly investigate this issue, as it is our duty as lawmakers and as representatives of our constituents. And not only that, the leadership of the House have already put its interest by confirming to Nigerians. So the House resolved to mandate the Minister of Health to give a detailed full status report of activities of the supposed Chinese medical team to the Speaker as agreed during their meeting of 7th April 2020. Mandate the National Assembly House Committee on Health Services, House Committee on Interior, House Committee on National Security and Intelligence, House Committee on Foreign Affairs to investigate the reports of the Chinese medical team, their whereabouts, and who they really are. I so submit, Mr. Speaker.